Before we get into some other things about electrical stimulation, the role of steroids, etc., I got to ask the question about the gorilla in the room. Your opinion, please. Medical marijuana for pain relief. What do you think?
So, I think medical marijuana is a little bit of a misnomer because we don't have any drug out on the market that has a dozen or 24, or in marijuana's case, 64 different active medical ingredients. And we don't have any dosing regulation. We don't have any dosing recommendations for it. It's not a medical product. It's a recreational product, but it's not a medical product. Now, there are products within marijuana that have medicinal properties and warrant evaluation. CBD, for instance, has relatively good evidence that it does have efficacy for certain types of pain, as well as a variety of other conditions. We don't utilize it enough because there really is the regulations around studying it are pretty restrictive. But there are certain entities within marijuana that I think are worth looking at and have potential. But as a whole product, as marijuana itself, I mean, cocaine comes from the cocoa plant. Or the cocoa leaf. It's one chemical within a variety of chemicals, just as marijuana has many different properties.
Pat, what is your opinion on that?
Well, I don't like people getting high to get their pain under control. And the THC in the marijuana causes a high. It also is addictive. And they say it's not addictive. It's about as addictive as alcohol. And the argument is that, well alcohol is legal. Well, alcohol's not legal for pain control. Alcohol's recreational. And it bothers me that a lot of people want to get recreational marijuana approved, and they're doing it on the backs of medical issues. I agree completely with what you're saying. It's a raw product, but there are things in marijuana that are highly beneficial, and the CBD is one of the things you mentioned, which, by the way, is plentiful in hemp. Yeah. And hemp is grown legally in Kentucky, industrial hemp, and I think they're working through whether or not that, how much they can put on the shelves and whatever. But hemp oil that's grown in Kentucky has a lot of CBD. That's cannabidiol, which has been shown to be very effective in childhood seizures and other conditions as well. But there are other things in the marijuana plant. In fact, it might even be a little bit of THC might be beneficial as well, but not enough to get anybody high. It's just like, bourbon will help pain, but we don't want people treating their hip pain with, bourbon every night. That's problems. And I think that if we treat this raw product, marijuana, as a medicinal drug, we're asking for problems.
Yet we also take codeine when people have coughs, and we know it's very effective as a cough suppressant when controlled and used properly.